In Fox 5 Health News, researchers say environmental factors in the womb may trigger autism.
And a popular drug to help smokers quit is linked to serious health problems. Fox News contributor Dr. David Samadi is joining us right now to talk about these stories and a lot more. And thanks for being here, Doctor.
Thank you for having me.
Dr. Samadi, let's start with the very concerning finding that the smoking cessation drug Chantix may cause an increase in heart attacks.
Yes, you know, I heard this morning, and this was sort of like a big news. But when you actually dig in and you look at exactly what's going on, they looked at about 14 different studies, and what they found was that there is some slight increase in the heart attack on patients that are taking this medication. But you have to be really careful when you examine these studies because the sample size is very small and the amount of percent of increase in the heart disease was really small. So the message is that instead of running to these drugstores and taking these medications, talk to your physicians and make sure you're really a good candidate for these and not just go for a quick fix.
Yeah, as you know, Pfizer, who makes Chantix, they have their own research and they said basically they found the drug works. More people quit who use it rather than those who don't use it at all. Do the benefits really outweigh the risks of smoking?
You know, I think it's an excellent question that we as physicians always have to deal with every day. Whenever we offer something to the patient, you have to go with the risk and benefit proportion and see if it really balances. The truth is that this is a last resort for you. You know, find other ways to quit smoking. That's the easy way, especially if you have history of heart disease. This is a medication that you probably don't want to touch unless you speak to your physicians. And if the benefit outweighs the risk, then you go for it. Otherwise, I think the medications have a lot of side effects, not this one, any other medication. And I always prescribe it as a last resort for these patients that are really desperate. They have tried every other modality and they have failed.
Okay, makes sense.
Is that actually a side effect on the drug, Chantix, or should that have come out in clinical trials?
Well, it is listed, but as you always know, FDA comes up with these updates almost every other year or so, and these are some of the things that it's good that they're letting people know. So be cautious. There's no causal and answer, you know, so we don't have 100% the answers. Just be careful, talk to your doctors before you take these medications.
Doctor, let's move on to another subject, okay? We want to talk about autism. Tell us about the link now that researchers have found about the condition of the womb, environmental factors, and autism.
You know, I'm glad that this study actually came out because when we talk among doctors on autism, it's sort of like a black box. No one really knows exactly what the etiology and the cause of autism is.
It's been a mystery for a long time.
Exactly right. And for years, we always thought, you know, that genetics plays a role, but no one has the answers. What this is really is shedding light to the fact that the environment can play a role. Whether it's prenatal, before the pregnancy, some infections, or infection during the pregnancy.
Yeah, explain that.
So if mom during the pregnancy can get an infection, that can affect the kid indirectly without getting into the details of this. If someone is taking anti-depressant medications, for example, before the pregnancy, that can double the risk of autism. Or if you take it in the trimester, the first trimester of the pregnancy is the most critical one. That's when the brain develops skeleton, bone, and everything else. So any kind of medication you take during that trimester can affect. So it's important. What this is telling us is that the environment can play a role. And they look at the twins and they realize that many other factors after pregnancy, right after pregnancy, that can play a role as well. So now it's basically widening the scope of how we look at autism and more questions than answers at this point.
A lot of parents are so interested. Tell us before you go, the role of antidepressants used during pregnancy. What should women be worried about?
I think taking any kind of medication, especially antidepressant,